you know. I remember there was a webinar, there was a training that we went for that Victor was talking about. There were mothers there and all, and we demonstrated how to use the drip. That was their first time of seeing it. And of course, the first thing they said was, oh, this one will be too expensive for us to put in our maternity bag. And we told them, no, it's just 1,500 naira.
Can
They were like,
imagine.
I remember when packing my hospital hospital bag and all of that, we put different things there that are more expensive than that, and maybe as needed as the drapes, right? So we put a lot of stuff there, but what is more important, the people don't know about it. What they're going to know about it is what we are doing now, and with all the other activities that we'll be running, they will definitely know about it. At this point, I would like to say, I would like to call on, every one of us that has spoken here to give, their final words. We are far gone. But before we do that, do we have anybody that would like to ask a question? That would like to ask a question or share a feedback? Do we have anyone here who would like to ask a question? Okay. All right, go ahead. Mr. Olorun Femi, you can go ahead, please.
Thank you for this lecture. I was, by privilege, just saw a message in my box, and I was very excited to be part of this call. I had a few experience with Eat Stable Carbetocin. Its emergence by WHO in 2018 was after the Champions trial, the trial that demonstrated that it is an non-inferiority trial where they try oxytocin and carbetocin, which involves, I think, 21 countries, and Nigeria was privileged. I was the principal investigator for the country because they used UCH and Ondo State that time. And since then, the experience we had with oxytocin and the use of calibrated drip had been very fantastic, and we've been preaching. But now I was so happy to know that this is easily available. But when you're talking about availability, somebody talked about South, somebody talked about North Central. I don't know where we can have. I've sent Victor some text message on WhatsApp to know the availability in the Southwest, because we have a study called Amplify now that is being carried out by John Hopkins with Jepaigo, in which we are doing in Kebbi and in Ondo State. So many centers are using it, but in research setting, it is not very available in other hospital settings. Some are interested, they want to buy, they want to use, but we can't get. So we'll be very happy to know how we can get all this into our hospital in Ondo State so that people can start using it. You are talking about the cost. The cost is doing a comparative study. There's no mother that will deliver vaginally that will not use this pad, underlay pad that they use, which costs close to 1,000. Most parents will use 2 or 3 of it. If you are privileged to use a calibrated drip, you will not need those pads, or at most one after the delivery when the person is in the postpartum room. So that means even the 1.5 is a reduced cost comparing to 3 perineal lay pad that the mother will use. So it's a good thing that we should continue to advocate, and people should see it as something that is affordable, and it should be accessible. Knowing this, it will go a long way reducing maternal mortality. The testimonies are there. When we finish the study, Champions trial, our nurses cannot forget the impression they got from even the Eat Stable Carbetocin. Yes, oxytocin still work, but do a random sampling, you find out that most hospitals don't even have refrigerator. When they have refrigerator, they don't have 24 hours light. So it is as zoom as if you are keeping it in a cupboard. Because what is fridge? What is a refrigerator without light? It's just equivalent to having a cupboard. Because it's just the shape and the name you call it. But when it's not powered, it cannot keep any cold chain. Even those that have refrigerator and keep in the fridge, the back side, when you look at the transportation, it is not in cold chain. So when you brought in a hot van and you come and put in the fridge, you already has broken the cold chain. So the effectiveness will not be there. If you look at Mother's Pack, some of them buy as much as 10 oxytocin because they want to deliver, in which each stable caprotocin, 1 ampoule will do the work. So it is a very important thing. Advocacy should continue. It should not relent until every state, every hospital see the benefits and the usefulness of each stable caprotocin. Thank you for your presentation.
Thank you so much. Thank you so much, sir. That is fantastic to hear. To hear it, to hear from someone that is using each stable caprotocin, and to hear you talked about so well. I'm so happy to hear that. I will definitely be calling upon you, sir, to have more discussions with you in your states, and of course to your peers. We'll definitely be calling on you. And for you to get it, it's available everywhere. I will share with us how the managed credit funds, exactly the steps that you should use to get access to it. We are delivering everywhere. Logistics cost is on us. All you have to do is buy, and you don't need to even buy. Don't need to have money immediately, because we know there's a lot of bureaucracy, and just make that available to you. So let me share with I will link the question of how to get it directly to Jennifer's question on what is managed credit, so that we can handle the two of them together. Please confirm if you can see my screen.
Yes.
What is showing on my screen, please? Okay, no. What I want to share is the...
Yeah, we can see that now.
It's off now.
Okay, thank you. All right. So what is managed credit essentially? Managed credit is our stock now, pay later system. And how did it come on board? When Field started, Field is the originating body for ShelfLife. Right? Field is the parent body, and ShelfLife is a product of Field. And we started by bridging the gap. Sheil mentioned something in the beginning. Supply chain network in Nigeria is fragmented. Demand and supply, they are not meeting each other where they should meet it. So the healthcare providers are asking. You can hear how Dr. Owa was asking just now. And the patients are there waiting for it to be used on them. The manufacturers are providing it, but then it's not just meeting each other. The supply chain is fragmented. That's how Field started, by bridging this supply chain digitally. And we didn't just do something, we didn't build a product that is inaccessible. We built a product that is digitized. What does that mean? Every single place you are in Nigeria, in Kenya, Rwanda, Senegal, with the product structure, infrastructure that we have built, every pharmaceutical material that you require will get to you, and get to you fast, in record time. You can follow it, you can monitor it, and delivery cost is enough. While we were doing this, we realized that the pharmaceutical sector will just, the retail aspect, the hospital aspect needs more help. Even the suppliers are not enough. That's why we started with ShelfLife. When we started with ShelfLife, we saw a lot of struggling communities, new pharmacies, new hospitals that didn't have so much to stock up their pharmaceutical inventory. And if you cannot stock up your inventory, all you are going to do is diagnosis, treat, and all. You need the pharmaceuticals, you need the consumables. And that's why we introduced this. So there are a lot of people doing different types, but what we are doing, we are the first to do it. And there's no collateral required. You don't need to drop anything. You don't even need to buy first because, oh, let me buy first. Let's buy first to establish a line of credit. No, we have the data that we require from you to ensure that you have the capacity to manage what we are making available to you. So it's a stock credit program to ensure that stock gets to you, and from the stock you begin to sell, and then you pay later. So that is what managed credit is, essentially. With this, we have been able to support over 2,000 pharmacies, several hospitals, several 2,000 pharmacies and several hospitals to ensure that they not only have stock, but they can supply, they can serve their communities as I went through. Just last year or this year, we started working with another organization to ensure that medicine vendors as well are getting access to all this that they require, because we realize that the demand is much, especially in the country in Africa. The population keeps growing. The demand is quite high. And how can you access this? All you have to go is go to www.shelflife.org, set up an account and apply for credit. If you don't want to apply for credit, you buy it directly. There is no middleman. For government hospitals, federal hospitals, state hospitals, primary healthcare centers, where there's a bit more red tape, we have people like Victor, we have people like Tobe that are ready to come and help you to cut through all the red tape to make sure you have everything you require. Discuss with your finance people, your procurement people. So the doctors don't have anything they're thinking about. They just want the product to get to them, and not just for research purposes, for hospital, for use with the patients. And that's why we have like pharmacies in Anna as well. Okay, I think for Basi Idang, I'm sorry, I don't know whether you're Mr. or your Mrs. For you to see all the products that we have, just go to shelflife.co, sign up, and then immediately you sign up, you get an email. You click on the email, and you can see every single product that we have in stock. We have over 3,500 products in stock. We have been working with several states governments, helping them to ensure that everything that they require, we make it available. And if you want paper copy, or you want to also have some appointments with you, Toby and Victor are here. All over Nigeria, Kenya, Rwanda, Senegal, we have people there. And for hospitals, patent medicine vendors, community pharmacies, wherever you are, we are there. So yeah, so rounding it up now, I'll be calling on my expert panel to give us their final words to us. I'll start with Shion, our supply chain expert.
Thank you, Yewande. This was quite insightful. I myself learned a lot, and I hope it's same for everyone. Just to round up with some statistics. So in Nigeria, for instance, there is this statistic that says every 18 minutes, a Nigerian woman dies as a result of postpartum hemorrhage. So probably by the end of this call, we've had one woman somewhere in Nigeria die, and the reason is not far-fetched. We know what the cause is, and it's preventable. ShelfLife is doing, or Field is doing its own parts. We have provided this medication. We've provided it as a bundle. It's cost-effective. It's cheap. It's easy to access, and it just requires people actually paying attention and buying into this. And we are guaranteeing quality medication, be it oxytocin, within the right quality, the right temperature, potency. We are guaranteeing that. So we just want everyone to take action, do something about it. It's starts with you and I. I was also reading a publication that said in a country like New Zealand, for instance, in the year 2020, just 13 women died from maternal mortality. And that same year, in sub-Saharan Africa, over 200,000 women died. So it's possible for us to achieve, no deaths due to bringing forth life. And it starts now. It starts with you and I. We just have to start paying attention, start stocking the right medication, partner with ShelfLife, of course, and we can do something about it. So that's what I'll be closing. Thank you.
Thank you so much, I'll call on Waneka.
Yeah, thank you so much, Yewande. My one request is simple. Wherever there's a system, it's important that we do not allow an empty shelf to be a reason for a woman to die. If we've got solutions, why not leverage it? We've been all about the managed credits. I think it's a very workable model for anybody, all institutions, all facilities that, attend to these women. So while we think that, or some people think that this might be an expensive approach to take, you've just mentioned that this medication that we're talking about is just about 1,500 naira. I mean, the price is actually ridiculous for the solution that it offers the women out there. So most importantly, for the pharmacies, for every policymaker who might be in the position to make choices or to, sign off models or MOUs to make this happen, to ensure that we'll have the right medicines in the hospitals and in the community pharmacies. Please ensure, I don't know if any of these policymakers are here today, but whatever the case, I'm sure most of the people who have attended this webinar today will take the message to their different facilities, their institutions, hospitals, and, as the case may be. Let's ensure that finances are usually, it's not a case for another woman to die tomorrow. It's important that we nip it in the bud. For maternal mortality is not something that should be left to linger as much as it's been lingering in Nigeria today. So I'm glad that we'll have a solution today. I'm glad that this wonderful company has come out today to propose solutions, and it's important that we leverage it to ensure that we mitigate the losses that we've experienced in the past. Thank you very much, Yewande.
Thank you so much, Monica. And I learned so much when you were talking about the business aspects. Thank you so much for your input. And we'll call on Toby. Is Mary still with us on the call? Okay, yes. Okay, Toby, your final words, please.
Yeah, so having understood that the use for this MNC Energy Bundle paid items, I would advocate, just like a couple of states have done, Plateau, they're trying to do the same for the primary healthcare in Abuja. Like has done the same. I would just want to beg, permit me to use that word, that anybody at the helm of decision making should just advocate that these items should be added to the delivery packs of these women about to deliver, because it's best when it's handy before she gets into the theater than she's on the table delivering and we now need 1 or 2 uterotomy, especially the calibrated drip, which is the first thing to detect the loss of blood. So for states that have reduced their PPH mortality due to PPH, what they did was just to incorporate the calibrated drip and the HS into the delivery pack. So whoever is on the call that is at the helm of decision making, that can put in a word out there so that these things can happen, so that we can reduce maternal mortality due to postpartum hemorrhage. Thank you, everyone.
Thank you so much, Dr. Joy. Said a strategic engagement with every state drug management agency. We are working so hard to get that done. There are a lot of people, so we are not the only one in this world. There are other people as well that are training nurses, training doctors, training everyone everywhere. You heard Dr. Wa talk about studies being done. We just need to talk more about the fact that it is available. It's available. And if you have, I see that you are going to be connecting with Victor. Whatever meeting needs to be had, we are ready to make whatever meeting needs to be had. We are ready to make that meeting available. Today is ready. Victor is ready. I am ready. I go everywhere. We'll be at Medical Women Association of Nigeria's conference. We'll be there as well, preaching the story. will be there as well. And if you're there, you can join us. Mary, over to you. I want to end with Jennifer. Mary, over to you. Okay, you can connect with Joy. Thank you so much, Dr. Joy. Victor, please share your contacts or get Dr. Joy or Paras. Over to you, Mary, your final words.
Thank you so much, Yewande. And thank you, everyone. It's been great conversing with us and sharing all of our perspectives, as regards postpartum hemorrhage. So now we all know that these products are available. We know that they are accessible, and then we know that there's even financing options for every one of us. Also, I think one other thing I would like to add is if, you are probably listening to this and what you're thinking about is, how do I know the appropriate quantity to stock? I don't want to be overstocked. I don't want to be understocked. I also like to let you know that Field also offers solutions for inventory management and demand planning as well. So, all of what you need, Feed can actually meet all of that. So, I want us to leave here knowing that we have the power to come together and reduce our current maternal mortality rates in the country. We can do it. We all collaborate and use all of the options available to us. So Feed is here to partner with every one of us, to ensure that all of those products are on our shelves at every time to meet each and every mother's need, all over the country. Thank you, everyone.
Thank you so much, Mary. Thank you. And thank you for bringing that up. I was going to bring that up. Thank you for bringing that up, especially when Dr. Joy and Fancy Edan was talking as well. Drug management enforcement agencies, procurement agencies, state governments, they'll be thinking, okay, we don't want to overstock. This is a new molecule we want to bring in. We talked about fragmented supply chains and how we have ensured that supply chain is digital. We have the software, we have the inventory management software to ensure that from your office, you can see exactly what has been supplied to every single primary healthcare linked to your office. If you buy 10 packs or 70 packs or 20,000 packs of drinks today, and you let us integrate your process with our software, where you have complete control of your data, you can see every single store that it has been supplied to. We have that technology. We have deployed it in all these countries that I'm telling you that we are in, and we are ready to deploy it to states, to state departments, to hospitals. We are ready to deploy it there. So Victor and Toby can tell you so much more about that as well. Or if you call the ShelfLife number, we can tell you about that. Or if you will reach out to us on the website, they can connect to us. They can connect you to us and make that available. I really like this picture of Victor that you are showing. This is Victor. Victor is the one in the suit pointing. The picture, why I like it so much is because you have in the background, we have the postpartum hemorrhage bundle, which consists of stable carbetocin, misoprostol, tranexamic acid, the calibrated drips. Is presenting on that, and all the other medications we have, consumables and all of that. We have them at very discounted prices. You have the doctor holding I don't know who he got to assist him, holding the calibrated drip. You have him preaching the gospel. And then you have this quote that I love so much. Notwithstanding, she shall be saved in childbearing. This is so profound that it's so profound, notwithstanding. And you see, I'll let Victor talk about what happened here as his own final words to us before I call him Jen. Victor, what was happening here?
Good afternoon again. So, what was happening? This was the first time the gynae team at University of Oyo Teaching Hospital was seeing the drips physically. So, apparently, they've been training, they've been research, but having the commodity in their hands was something they're not able to do. So this was the first time, and it was really amazing because we had both consultants, then we had student doctors there. At this point, I was told to wear the drapes. So I had to speak to one of the doctors who was glad enough to hold it. And they were having antenatal classes in this same hall. So it was really, really interesting for the mothers, both first-time mothers and second-time moms, to see, okay, we could use this. And it's beautiful. And Uni currently uses drapes. We supplied them last 2 months. They're almost exhausted. And we're getting more to them. Thanks, Yewande.
Thank you so much. And thank you so much, Victor. You're talking about gynecologists, consultants, and all. I would like to call on Dr. Wa. Please share with us your contact so that we can reach you. You can share through Victor's WhatsApp contact in the chat, or you can drop it, or you can send us a message. Please, we would like your contact so we can reach you as well. Our representative can reach you. Okay, you have his contact. Oh, okay.
Yes, we've done that already.
Oh, thank you so much, Kak. Okay, so over to you, Jenny.
All right, thank you. I was just laughing when Victor said that. I was imagining how he felt when they told him to wear the drapes. Yeah, so thank you so much, Yewande, and thank you, the team from ShelfLife. I must say this is really, really impactful. I'm happy that we are bringing solutions on board. And what makes it most important and what makes it even better is the fact that these solutions are affordable. Understanding where we are, understanding the healthcare system in Nigeria, and understanding how a cash crunch can actually prevent, patients to have access to quality, life-saving medications. I am happy that these solutions are here, not so far away. So maternal deaths are preventable, just like we said. We just need to take actions, and we need to take actions today. We've been able to unpack that most of the issues are not just because the people don't know what to do, but because of stockouts. Now the solutions are here, and to also make it, better, we also have, solutions which is also taking away the cost barrier. So this means there are no barriers. We need to advocate for this. We need to talk about it to save the life of the mothers. Women, we know, are the powerhouse of every economy. So imagine how much we can do. Imagine how much the economy can improve if we are saving the life of the mothers who are also giving birth to the younger ones who will improve the economy. So it is a ripple effect. I am calling on every woman here, women in pharma using our platform, women in all healthcare system, who are in the forefront or who have capacity of policy making in any capacity as well within the healthcare ecosystem in Nigeria. Let's make this happen. Let's use our voices. Let's use our network. Let's use our capacity to ensure that we support the field team, we support the ShelfLife team to ensure that every facility, one facility, at a time, especially in the underserved. I am very particular about underserved because we know what happens there, especially in the underserved areas, that they are aware of this, number one, and it's also available to them so that we can save the life of the mothers. Thank you so much for having me here. I am happy to have this conversation, and I learned a lot about this. I am so happy to also be part of the people who will be pushing this model, pushing this solution to the, to people that need this, especially the patients, so that we can save the life of the mothers. Thank you so much for this. I am going to see what we can do from our platform as WIPSA to partner with Shield and make sure that every woman who needs just 1,500 to get this would happen for them. And then the lives of, imagine the family that we would also be saving when the mothers give birth, and the mother and child are alive and kicking healthy. So thank you for this solution. And we are also standing in partnership with Field to see how we can push this to places where they are needed. Thank you.
Wow, what an intense and insightful discussion that we've had so far. And first of all, thank you to everyone who has spoken to the panel. Thank you so much for everyone who has spoken today, from the audience to the panelists. It's been very insightful. And we started the hour by saying, what's killing our mothers? I believe that we have found the answer. It's not a lack of knowledge or lack of solutions. It's primarily the lack of access. We've seen that. It's the lack of access. You can imagine a pharmacy that is outside the hospital cannot help the hospital cannot help themselves, or a place where the doctor, like Dr. Wan, knows about it, wants to use it, but the news about the access has not gotten to him, or the delay in supply chain, or the cash flow gap. We've heard about it, and we've heard the solution. We've seen how with the PPH bundle, PPH bundle combined with managed credit, removing finance as a barrier. We've seen how working together with field, working together with ShelfLife, we have created the readiness. And now with the women in pharma and the men in pharma and medical leading this charge, we can say that going forward, sharing this news, no provider should be able to say, no, we don't have it. We have it. When a mother's life is on the line, we have it. So for the conversation to end now, our work just begins. If you're a community pharmacist that you're watching this, ensure you have this product on the shelf. Well stored. Join ShelfLife, get it on managed credit, and serve your community. If you are in the health space, you are in the public health space, please have conversations with us. Have conversations that drive this. Include it in policies where it needs to be, to ensure that everybody can have it in their pack. And for everyone that has heard today, you are now an ambassador. You are now an ambassador for this cause, right? You are an ambassador for ending maternal mortality due to postpartum hemorrhage. In the next 24 hours, we'll be sending everyone that registered an email. The email will contain a replay of the webinar. We'll cut it in parts because it's quite long, but this is where it will be hosted on our YouTube channel and also on the website YouTube channel as well. We'll be sending you an email where you can watch it in parts, and then the email will contain a toolkit of how you can get in touch with us, phone numbers that you need to call, what is inside the toolkit, what are the costs in the different currencies, and information that you need. That should happen in the next 24 hours. And you can always reply to ask any of your questions. My own call to action, my last one is that for every mother, my desire, and our desire and fear, for every mother that is going to the hospital, in your hospital pack, there should be one calibrated repair. In every hospital that you know that electricity is a problem, you should have each stable capitation. Wherever you are in Africa. That is our call to action. So thank you so much again, everybody, and we'll end our webinar here. See you on the next one. Enjoy the rest of the day.
Thank you, Yolandi.